Well, it's a real honor for me to be part of this program today. I was asked to talk about the history of the Department of Ophthalmology, which spans back now 85 years, from C.S. O'Brien to our current chair, Keith Carter. You know, the eye is, as Steve has been talking about, is a wonderful organ. It's described that 80% of the information your brain processes comes from the eye through the optic nerve to the brain. And it's a tremendous organ, and it's a very small organ, but we somehow managed to divide it into lots of little pieces to consider and to treat and to do research on. And rather than try to give you a sense of the entire Department of Ophthalmology over the last 85 years, I thought I would just talk about the glaucoma service because that's what I know best, and it's a little bit more manageable subject. But I'll talk about the glaucoma service just as a reflection of what happens throughout the Department of Ophthalmology. And I'm going to highlight 5 things: the history, stability, excellence, collaboration, and growth within the service and within the department as a whole. And as I talk about the history, I'll talk about a timeline starting in 1958 to the present, 2009. Our service started in 1958 with a man named Mansour Armali from Lebanon. He was here till 1970. And Dr. Armali, when he was practicing at Iowa, was clearly one of the most renowned ophthalmologists in the world. In a rather daunting paper for me when I started here to read, Dr. Armali was the author of 6 of the 100 most cited papers in the archives of ophthalmology in its history. He's the person who first determined what the normal pressure in an eye is in a study in Des Moines in the United States, and is a pioneer in the epidemiology of glaucoma, trying to find out who gets glaucoma, who's at risk for it. He left to become the chair of George Washington University's Department of Ophthalmology. I think one of the really nice things in my career is that when late in his life he decided and his family decided to endow a lectureship, they decided to endow it here, even though he was a chair at GW for 30 years. Because this was his academic home, and this is where he was so productive, and it was my great pleasure to know him well. This year we'll have the 6th Armali Lecture by Paul Lichter, who's the chairman at the University of Michigan. Dr. Armali was followed by Charles Phelps from 1972 to 1985. Dr. Phelps did pioneering work in glaucoma on things other than eye pressure that cause damage to the optic nerve, things like migraine headache, Raynaud's disease. He designed some of the very first national multi-center trials involving glaucoma research, and unfortunately died very young in 1985. He was a founding member of the American Glaucoma Society and was held in such esteem that the very first meeting of the American Glaucoma Society was held in Iowa City in his honor. And the tree that is outside Dr. Carter's office, our chairman's office, was planted by the society in memory of Dr. Phelps. I came here in 1987, and it was amazing really to have credibility without having ever done anything, simply because I sat in the office that was occupied by Armali and then Phelps. The other thing that our service shows that's also true of the entire department is stability. There have been 3 heads of the glaucoma service over the 51-year history of the glaucoma service. One died, one left to be the chairman, and I'm still here holding down the fort. We had Paul Munden, who was a clinician with me for a while and left for private practice. And in 1996, Young Kwan joined me and has been with me ever since. And Young brought with him not just great clinical skills, but also a PhD in neuroscience and some tremendous scientific skills. Like the rest of the department, I think we have a tradition of excellence, and excellence in the 3 arms of academic medicine: patient care, teaching, and research. We have glaucoma clinics 5 days a week. We have glaucoma subspecialty coverage at the VA hospital and perform more than 400 glaucoma operations a year. Dr. Kwan and I are both privileged to be members, or considered among the best doctors in America by that group. We have a very active teaching program. We always have 1 medical student and 2 residents on our service. Over the years that the glaucoma service has been in existence, we've trained 41 clinical fellows and research fellows who practice in 21 states and 7 countries. We've also taught people far away by writing books. My first book was listed as one of the top 100 ophthalmology books of the 20th century. And we also have 2 very active websites. Drs. Kwan, Greenlee, and Fingert have a patient's guide to glaucoma that is accessed by people around the world hoping to learn more about this disease. And I have a website that has 200 videos teaching people how to do an exam technique called gonioscopy that is accessed by people in 105 countries. As was mentioned earlier, we have a tremendous opportunity for research here. Because of Dr. Stone and Dr. Sheffield, John Fingert, Rob Mullins, and a host of other people, we are the world's leaders in the molecular biology of glaucoma. We discovered the first and still most important gene for glaucoma, myocilin, and have discovered more glaucoma genes than any group in the world. We're also the world's leader because of Chris Johnson in the measurement of visual function called visual fields. We're among the leaders in photographic imaging and telediagnosis of the optic nerve, animal modeling of glaucoma, and optic nerve cell biology. I think it's telling that when the New England Journal has wanted papers to review glaucoma that they have come to us, me in 1998 and Dr. Kwan in 2009, to write review articles about this disease for the premier medicine publication in the world. I think obviously patient care in many ways takes care of itself, but for teaching and research we've been very blessed, like the rest of the department and the college have been blessed, with a wonderful philanthropy. In our case, the Frederick C. Blody Chair that I hold, the Altermat Professorship that Young Kwan holds, and most recently the Hadley Glaucoma Research Fund, which helps with much of our day-to-day new exciting research. As was mentioned earlier, we have a tremendous history of collaboration throughout the department. In our service, we collaborate obviously within the department, within the college, particularly with pediatrics and physiology, within the university with engineering and public health. We have a tremendous relationship with the veterinary school at Iowa State that has many large animal models of glaucoma. At universities throughout the United States and throughout the world, the Aravind Eye Hospital in India is the largest eye hospital in the world. They see 1.2 million patients a year. And their genetics program was developed by Dr. Stone, Dr. Fingert, and myself. And like the department, we have seen particularly recently growth, not just in numbers of people, but in quality of people and areas that they cover. So this is the same timeline I showed you earlier. We had one member in this service. I was a one-man show early in my career here from 1958 to 1990, and then 2 members up until 2003. And we're now 7. We now have Emily Greenlee providing care for our veterans at the Veterans Hospital, Marcus Kuhn doing cell biology, John Fingert doing clinical care as well as molecular biology, Reed Longmuir covering diseases of the optic nerve, not just glaucoma, but brain diseases that affect the optic nerve, and Chris Johnson, who is the world's guru of visual field measurement. I think our greatest strength, though, throughout the department is true teamwork, the desire to find colleagues who are smarter than we are, and obtaining joy in seeing them succeed more than we've succeeded. So these are the 5 points that I think are worth telling you about the glaucoma service, but just remember that they are true for all these other services throughout the department. Thank you very much.